Well, so like I said, three focus states, Maharashtra, Delhi and Karnataka, have now called for emergency meetings to re-strategize and reimagine the containment strategies. Clearly, something is not working on ground. For a state like Maharashtra, there are big worries. The daily caseload has gone above 23,000. It's very close to the peak witnessed in October last year. So that, of course, has become the prime cause of concern. And overall context, nearly 36,000 fresh COVID cases reported. India's coronavirus worries are far from over. In fact, following Maharashtra, Delhi and Karnataka are also Punjab, Kerala and these two states also showing a spike. Tamil Nadu, a poll-bound state, is registering increase, especially in cities like Chennai, and there are new measures being announced as well. I'm going to go across to my colleague and Mirna correspondent Mugilan, who's joining us from Chennai. Mugilan, it seems the district authorities are very much on the job because you have to learn lessons from other states like Maharashtra, and while you have the time and the luxury to do so, probably tighten all the curbs. What exactly is happening in Tamil Nadu right now in terms of restrictions imposed to curb the infection?
In last 2 weeks, we have seen a very sharp spike in the number of COVID cases that are being reported on daily basis, and most of the cases are coming from Chennai alone. Yesterday, 945 cases were reported in Tamil Nadu and 395 cases coming from Chennai alone. So definitely this is turning to be a cause of concern for the health department officials. Now we are seeing several measures are being put up by the health department officials. Now they have ramped up the testing here in Chennai district, and COVID care centers which were used to be set up last year were closed after the fall in the COVID cases. But now, once again, the COVID care centers has been reopened in various parts of the district. Even today, there was a 4,800 bed facility COVID care center was reopened by the health secretary. And then here in Rajiv Gandhi Hospital also, a separate ward also has been created to handle the surge in cases. So in last 2 weeks, the positivity rate was slowly inching, and now we are seeing it has crossed 3% here in Chennai alone, whereas the state's positivity rate stands below, so little above 1%. So now Chennai officials, Chennai district administration officials are taking various steps to stop the spread of COVID virus infection. And now we are here in Thiruvanmiyur market. Today morning, we saw the corporation commissioner inspecting the very place and creating awareness among the vendors and the people who come here to wear face mask. One constant complaint what we are getting from the health secretary and the corporation is that non-compliance of the COVID guidelines and not wearing face masks. And they also state when the officials come to these public places for inspection, people tend to wear masks, but once they leave, the habit of wearing masks is not there once the officials leave, is what we heard from the health department officials also. And now we can see at least 50% of the vendors or the people who are here not wearing masks. So this is the kind of situation, and the health department officials also they request everyone to wear face masks to contain the spread of COVID virus infection. And as I said earlier, there have been several measures also now being initiated by the health department and the Chennai administration to keep a check on the spread of the infection.
Yes, we can see there most people behind you, Mugilan, were wearing masks. Some of them are not wearing it correctly. They're not wearing it above the nose. So clearly the sense of awareness, the sense of alertness that there's infection around and one needs to be careful, that is not there, or that has slipped away over the past few weeks, and it needs to be brought back. That's the big concern. I'm going to introduce my guest this afternoon, Dr. Shashank Joshi, Dean of Indian College of Physicians from Lilavati Hospital, also a member of the COVID-19 Taskforce in Maharashtra. Good afternoon, Dr. Joshi, and Dr. Dileep Malvankar, Director of Indian Institute of Public Health and member of the COVID-19 Task Force in Gujarat. Good afternoon, Dr. Malvankar. Thank you so much, gentlemen, for joining us. As always, we would like to have some clarity because the messaging is so important and so critical at this stage. Dr. Shashank Joshi, you've always come for our shows and given us clear understanding. And once again, I want to begin by asking you that today is the biggest challenge dealing with the human tendency, the sort of the COVID protocol fatigue that has set in, the complacency that has set in. That is costing us a lot because, I have also inferred from your previous appearances in my shows where you have said this very clearly, but how can we change the messaging? Because sometimes the message is lost when we say the positivity rate is reaching 20%, the man on the street is not able to decode this. Can we rephrase that? Can we say something like 2 out of 10 people out there are infected? Where do you see our messaging not correct or people are simply not getting it?
So, Frida, thank you so much for asking these valid questions and having me back again. You are very right. Virus in the mind is more dangerous than virus in the body. And I think the virus in the mind is that the mindset of people have gone through either a rebellious tendency, a revengeful tendency, or a fatigue tendency. And I think it's important that we take them and take their confidence, make them responsible and behave appropriately. Unfortunately, people on the street are not taking it seriously. And we need to have some very strong messaging. In fact, I would appeal, and we have appealed to the government of Maharashtra also, and I would appeal to others also, that people who have lost their lives in COVID, their relatives should come and actually appeal to people at large. That will make an impact. We all need in the regional languages to make them understand that COVID is very much here, and there is no fear of a lockdown. If we don't behave appropriately, that may happen. We will need to take people in confidence. So information, education, counseling is mandatory. But beyond that, some amount of policing is also mandatory because India is a very peculiar country. Unless and until we don't police them appropriately, they are not willing for appropriate behavior. The third thing, with the biggest problem we are facing today is the spreaders and super spreaders who are silent. Because the current viral strain, whether you call it mutant or normal, is basically predominantly asymptomatic. And those people, once they get the virus which is positive, they need to be home contained or institutionally quarantined.
Yes.
That is where we are finding the biggest nightmare there. And we need to do a very aggressive contact tracing of 1:30. We are faltering on both the fronts. So I think our public health strategy just cannot falter, period. And I think people at large need some cooperation and they need to reduce and they need to sort of apply a circuit breaker. I think that means we need to stagger, we need to slow down, we need to stay at home, get out only if necessary. And they need to just get one feeling, COVID is around again. We just need to stay home for unless necessary and take right precautions if we are going out. And if that's all we need to do for a few weeks, we will be back to normal again. But I think that's not happening. They are just into a rebellious mood. And I think a mood change or a behavioral change of a fractured mind.
So, Dr. Joshi, collectively people will have to do it, isn't it? Because, the kind of population that we have, if everyone collectively, collaboratively does not decide that this is something where we are together in it and this has to be done, somewhere that mindset has not set in yet. And unless that sets in, we are in trouble. Dr. Malvankar, very nicely Dr. Joshi put it that, there's another kind of infection that we are dealing with, and that is also infectious. This mindset, there's a herd mentality. When one person doesn't follow the protocols, the others follow suit, and that is how it goes. What do we do about the non-compliance? How do we deal with this? Because that seems to be the biggest challenge now that the authorities are having to deal with.
Yeah, I think this is a very important topic you have picked up. Dr. Joshi has already mentioned what we should do in terms of bringing back the idea that COVID is still there and it is rapidly increasing and it is in the uptrend. Now, if you see that cases are increasing by 20-30% every day. So my other suggestion is also to bring in not only those whose relatives have died, but those who have been on ventilator and survived. And let them talk. What is the feeling of a man who was all right before and going on a ventilator for a few days and coming back alive? There was a film a lady from UK had put on YouTube taking off her mask and talking for a few seconds, and which made so much of difference. She said, this is very terrible, like you are hanging between life and death. So some such very stark realities which hospital people see every day have to be brought in by the media and shown to people,
Yes.
discussed, and see that this is not a simple cough and cold, and it is rapidly spreading. So that is one side of it. Second, I thought, is the kinds of bills people have been charged and paid. If that is also made, of course, government treatment is free, but in private hospitals, people have paid bills of 5 lakhs, 8 lakhs, 10 lakhs, and maybe even more for a few days of treatment, which is in intensive care. And the third group we should bring in is people who are continue to suffer because there are long COVID. People continue to suffer with decreased lung capacity, etc. So that is one part of it. Second is also to bring in some people to say that don't do any assemblies for whatever the purpose, social purpose, political purpose, religious purpose, because in India, bheed or crowd is our nature. And we are not individualistic, we are highly socialistic. So we have to also change that. Plus bring that whole discipline which was there. There were circles outside shops, circle outside offices. People used to stand in those circles. Only 2 people would enter the shop. Now that all seems to have forgotten, gone. So we have to reintroduce that system. And again, the same, as he said, don't go out.
Let me just summarize, because you have made some very important points, and I'm going to take the liberty to underline each of the points that you have said, because this message needs to go out there. What you are saying, of course, you said that media has a responsibility, and let's bring out those people who have gone through the ordeal and let them talk. Yes, perhaps we have not done that enough. That needs to be done. But the other important thing that you said, and I would probably want to reflect on it as well, that the people who have recovered also have post-COVID complications. So the price to pay for not simply wearing a mask or not maintaining hand hygiene is huge at a personal level, and also at the the hazards that you pose for your other people around. Now, on this point, I want to ask you, Dr. Shashank Joshi, that if you think about it, recently Gauhar Khan, an actor in Mumbai, was found to be shooting with the infection. So there is a impatience, there is a desperation to get back to work, to go back to business as usual. Again, I want to ask you that this tendency is there everywhere, but somehow the state of Maharashtra is very badly impacted. Is it because the tendencies may be the same, but the manifestations are different? Why is Maharashtra head and shoulders above all the other affected states?
For that Gauhar Khan's case, I think I congratulate BMC for following up with her. And there should be zero tolerance for this. This is completely callous and inappropriate behavior. Maharashtra probably is a little unlucky for 2 reasons. One is that I think they and Kerala always get the virus first. I think the whole thing will happen across the country, which I don't wish and pray we can stem it. Second thing is, I think we are population density and migration and is very high. I think what happened in Vidarbha and Marathwada were less exposed regions, and probably there was a mutant strain there. But I don't want to blame it on a mutation. It is fundamentally public health strategy faltering in a big time way. And I think our public health accountancy has been poor. And we need to fix up responsibility and ensure that we don't falter now. We ramp up our testing, we ramp up our tracing, ramp up our treatment. And there is absolutely zero tolerance for asymptomatics at home. The biggest problem which we are facing today are asymptomatics at home, think they are absolutely okay though they have COVID. And they are the spreaders and super spreaders. And because this current strain is predominantly asymptomatic at home, that's causing the big problem. What Gauhar Khan did is, I think we will need to have some stringent penalties for people like this, not just institutional quarantine. We need to go beyond that because it's completely unpardonable. It's completely showing callous attitude. Whether it is a common man or a celebrity, they need to be responsible on behavior and not reckless. And they cannot do things which are going to hurt people at large and spread the pandemic further. If we are going to have such examples, it's a painful thing for the country.
Yes. You spoke about zero tolerance for those who are asymptomatic. Probably they should be institutionally quarantined. Can the authorities take such a decision? And also Dr. Malvankar also talked about how there should be, some things should be non-negotiable. Assembly of people or public gathering should be something that should be completely banned, and that's some of the harsh measures are required. Let's bring in some breaking news coming in from Tamil Nadu first.